explain autism, you would want to see the triad. If you suspect your child has ADHD, the best way to approach ADHD is by ruling things out. There's nothing fundamentally wrong with that child. What's fundamentally wrong is that society around that child doesn't understand.
Hi, welcome to Changing Suits. My name's Bal.
And my name's Taj.
Now, as many of our listeners may know, and you should know because it's been all over our social media. So if you're not following us already, please do follow us on Instagram and Facebook. There's your plug at changing_suits. That's correct. Okay, so going back to it. If you have been following us, you are well aware that we do a number of events to raise awareness about a number of issues, because many issues we don't talk about in the South Asian community. And one of these things is mental health and learning disabilities. So we are doing events on both of these things. Today's guest is a pharmacist who is a specialist within mental health and has a special interest in autism and ADHD. Today we've been joined by Gurmat Singh. Gurmat, could you give us a proper introduction in regards to yourself, please?
Yes, I'll try. Where do we start? From birth?
No, we don't want to go. We don't want to go straight from birth, but
let's not go that far back. No, I'm joking. I'm Gurmat. I work as a mental health kind of clinician in Telford. I've been specialising in mental health for kind of over 10 years. And I started off in adult mental health. And mental health in itself is such a vast subject, and it's impossible to almost be a specialist within a mental health specialist. So I kind of focus on neurodevelopmental conditions, so kind of things like autism, ADHD, and even things like anxiety and low mood, etc. So I work within the NHS. Known as a CAM service. So CAMS really just stands for Children Adolescent Mental Health Services, and more recently I've set up kind of my private practice, again focusing on autism and ADHD, assessing children and diagnosing children and offering kind of treatment plans, etc. So that's called AG & Co Health.
Okay, so Gurmat, let's start off. What is autism and ADHD? I think that's a nice place to start.
Yeah, the two such kind of vast subjects, and autism and ADHD can often be kind of confused. They can often present in very similar ways, and I guess I'm just going to try and explain it how I sometimes explain this to parents, for instance, just starting off with autism and ADHD. So sometimes we'll have referrals made to our services, and and the referral will say, "Oh, we think this child has ADHD. Can you assess this child for ADHD?" And it'll list a whole load of symptoms such as they're struggling to pay attention. They're in the classroom, they seem to get distracted, and they seem to kind of want to constantly move, and they quickly go off topic, and they're not following the flow of the lesson, etc. And when you delve deeper into that person, and you kind of explore a little bit beyond such a vague kind of description, you can get a much kind of better understanding of what's the potential root cause behind some of these difficulties. So if we were to explain autism in a very general sense, autism is, again, a neurodevelopmental condition which kind of impacts the child at a social level. So there's a triad of symptoms, so a trio of symptoms that kind of characterizes autism, which is social impairment, so difficulties with kind of forming social relationships and maintaining those social relationships, and that can vary from how you would expect a 2-year-old to form social relationships to how a 30-year-old would form those social relationships. So it's not kind of a stick in the sand almost. For example, a 2-year-old, you would expect, for example, I don't know, if you're playing with a particular toy, that child may want to kind of share that interest with you, and may want to look back at your face as a parent to see how you're responding to the child playing with that particular toy. Whereas in a child who's autistic, they may not necessarily do that. So we call that joint attention. Is the child and the parent sharing the enjoyment of a particular object? So that's a form of kind of social interaction, how we enjoy things together, and in a relationship. And you can extrapolate that to how would that vary in an adult or a teenager, for instance. That if I had a particular if I was interested in something that you had no interest in, say I was like, oh, I watched a football game last night, it was amazing. Did you see the final? And you were like, I'm not really interested, but you're gonna go along with it because you know it's part of my interest, and you're going to try and share my interest with me even though you're not interested in it. That's what we do in all relationships, don't we? Sometimes our husbands or wives will share stories with us when
I've
I'm
got
not
to say, I
interested in
don't.
it.
My
But
husband goes on about football. I'm
well,
like, switch
yeah,
off.
yeah. Switch on. There we go. Well, that's it. And that's what you tend to see in autism, that if you're interested in something, I'm more likely to not really reciprocate that. And that's the essence of a relationship, isn't it? We need to reciprocate with one another, reciprocate, um, enjoying something together, reciprocating in a conversation.
With children, I
Yeah.
understand. Obviously, you get that interaction, but what if you do have a child who just isn't interested in whatever you're, a toy, and they don't want to interact? How
Yeah,
can
yeah.
you differentiate in that case
Differentiate. Yeah, yeah.
between autism or the child just isn't interested
The
in?
child's not
Yeah.
interested. Yeah. So again, everything's very context dependent. That's something I've really come to understand. Not just life and mental health, everything is based on the context. So yes, you could be quite right. For example, I could be talking to you about Manchester United Football Club, and I have no interest. I have no clue what you're talking about. You wouldn't expect that to be repeated in lots of other contexts. So a different context could be where the child's enjoying something that they're enjoying, and you want to actually take an interest in what they're enjoying because you want to kind of develop your relationship, or enjoy something together. That child may not necessarily involve you in their play and be able to share that enjoyment with you. So there's almost kind of, and what I often say to parents, as much as we say never compare yourself to somebody else, it sucks the joy out of. There's a saying, isn't it? It sucks the joy out of whatever you do when you compare yourself to somebody else. But when we're thinking about neurodevelopmental conditions, things like autism and ADHD, it's important that you do compare your child to another child, because what we're trying to see, what are those differences in communication styles, in kind of their social interaction styles. But yeah, to your point, yes, you could expect that with the odd subject or the odd
But not
interaction. We
everything.
all have
Yeah.
good days and bad days, but if we start to see a repetition and there is a genuine lack of reciprocity, that should lead on to more questions. That what's the root cause to this? What's going on here?
I remember when my kids were small, in that first year, you look at those, what is it, the steps that they should,
Developmental
developmental milestone.
milestones.
That's
Yeah.
exactly what it was.
Yes. Yeah.
Do
Yeah.
you then
Yeah.
also have that? And I'm sure, because we still want to go over the other two aspects
Yes.
that you
Yeah.
look
Yeah.
at. Do you still have that beyond, I think it's a year and a half or something, where you are looking at the milestones then? Because
That's right, yes. So you have what's called like gross motor milestones and speech milestones and fine motor milestones. So yeah, you're right. They will probably go up until the age of 3 or 4. For example, things like being able to pick up a pen, or being able to use a knife and fork, being able to ride a bike, being able to kind of climb a tower, etc. Yeah, so there is some evidence that some of those motor milestones can be delayed in autism. But yeah, expect you wouldn't expect much differences beyond the age of those motor milestones aren't really measured much beyond those early years. So in autism, it's not so much that we're measuring those gross motor and fine motor milestones. We're measuring, I guess, so past the kind of social interaction skills, their ability to use their imagination, their ability to kind of move from one interest to another interest to another interest. So just to explore the other features of autism, so social interaction,
yeah,
communication styles. So that the communication styles may be kind of somewhat less richer than someone who potentially may not be autistic. Their
can I just
interests.
ask, what do you mean richer? As in they talk less, or the vocabulary is less? What do you mean?
That's right. So, for example, I call it kind of playing conversational tennis. So I could say to you, Taj, or Bal, how was your day yesterday? And he could say, yeah, it was a sunny day, and we went to the park. Oh, what park did you go to? And we'll just kind of have a rich interaction with one another, and we'll play conversational tennis. Will want to express an interest in what you did. I'll ask you questions. I'll explore where you went. Who did you go with?
Is it true that that we are all on some part of the spectrum?
Yeah, this is talked about, and I sometimes try and make sense of this. You hear different experts even say this. There's some experts that we're apparently all on the spectrum. I don't believe I agree with that. And there's a particular academic called Dr. Luke Bearden, and he produced this great equation, actually, just to throw this equation out right now. So Dr. Luke Bearden says no, he doesn't agree that we're all on the spectrum. That's almost an insult to those who are on the spectrum. Autism is a very specific characteristic of those triad of symptoms, which is restricted interest. So I think this is the key distinction here, and I say this to all the parents I see. All autistic behaviors are totally normal. This is the key thing to understand. Like you said earlier, if I was to talk about Manchester United, you could say, well, actually, I'm not interested in this, and you'll shut up shop.
Mm.
That's a totally normal thing to do. It's a totally normal thing to do where you could talk about how your weekend went, and I may not show much of an interest because I could have had a bad day, I could have had an argument with my wife, or I've got other things on mind. That's a totally normal thing to do. It's a totally normal thing to do to be hugely interested in something, and that's what you're really interested in. So they're all normal, totally normal behaviors. But what marks it as autistic is when it's kind of almost crosses a certain threshold, and then you see the combination of those features. Do you see what I
But
mean?
as a parent, that must be really difficult to pinpoint. For example, I've heard quite a lot of parents, as you do in the playground, just talk about your children. And it's more with boys that I've seen parents say this with. So you'd say, oh, my son just looks into the air and you don't know, he's just daydreaming all the time. You speak to another
Yeah,
parent, oh, boys just all do that. My son does that as well.
yeah.
Is that normal? Or is it you have to look at the individual child? And if you have to do that,
Of,
then
of
that makes it difficult for the parent to identify it as well.
Totally, and this is what makes almost assessing autism and being able to kind of have a high degree of kind of you know um, accuracy almost in making the diagnosis. You almost need to have a real good detailed history of that particular child. So taking that just in it on its own, for example, and that also can be a feature of ADHD. This is where it gets super complicated. That you could say, yes, my child tends to daydream and they gaze out of the window, and we try and talk to them, and they're lost with the fairies. So another term, and this term is used more from an ADHD perspective. It's part of the criteria when you're making a diagnosis, and that particular term is what's called functional impairment. So, functional impairment basically means if your child is there gazing out of the window and it's now leading to impairment in their ability to live their day to day life in school, they're missing out on lessons because they daydream out of the window, or at home, they never seem to get anything done because they're daydreaming, lost in their own world. There's an impact in their ability to live their day-to-day life, for instance. So we call that functional impairment. So it has to cross a certain threshold.
I'm well aware that we've covered two of the features of it, and I'm like, and this is how complex the whole thing is, where we've digressed so many times, and I just want to bring the third one, just so our listeners know all three.
So yeah, so back to the kind of the triad of symptoms. So it's so kind of social interaction. So looking at their interaction
Yeah,
styles. So interaction could be kind of your social cues and
yeah.
body language, etc. Impairment in their communication styles, and then the third one is, like I say, repetitive in their kind of pattern of play and then the type of activities that they do. So, for example, you may have a particular child that they're quite repetitive and lack the imagination in how they play with their toys. So you might have a child who's autistic and they'll play with the car and they just ride it up and down the windowsill or up and down the kitchen floor, and they don't really go beyond that. So they're quite repetitive, or they may be repetitive in the way that they watch the same particular TV program again and again, that same particular episode, or that same particular jingle. There's a certain repetition in their style of play.
Like Taj said earlier, you might have a child that does look out the window, or would you have to look at all three of those things in the triad before you say
That's right.
yes,
That's right.
that child has autism or
That's right.
ADHD?
Yeah, so that's also another key distinction between autism and ADHD. So in autism, you would want to see the triad. You need to see all three. It's not that you would just see the one and you can discount the other two. There needs to be evidence of all three. So evidence of social interaction, communication styles, and that repetitive and rigidity in their play and in their thoughts and in their kind of day to day activities. Whereas
I was going to say, so what is the difference with ADHD? Because
So with ADHD, so in ADHD, you also have a triad, or they're sometimes paired in two. So one symptom is inattention, struggling to pay attention. You daydream, or you get lost in your thoughts, or you get distracted by what's happening around you, and then you lose focus on what's being taught in front of you. So that's the one key symptom. The other symptom is known as hyperactivity / impulsivity. You can be very hyperactive. Boys tend to be the more hyperactive, if I was to generalize. Running around, climbing things.
That's
and
the
they're
most
quite
common one
impulsive.
that we hear about, the running around.
That's right. That's right. Yeah. And they're quite impulsive. They do things without thinking. So in ADHD, you could be diagnosed with just the inattention type, which, again, to generalize, girls present more with the inattentive features. They tend to be the daydreamers, again, to generalize. Or you could have someone who just has the hyperactivity, impulsivity features. Or you could have someone who has both inattention and the hyperactivity, impulsivity. But for me, ADHD is just too vague of a diagnosis. It's too superficial of a diagnosis. So often I see many children where they've been referred by parents, by school, even by professionals, to say, we think this child has ADHD. They can't sit still. They're running around. They're not paying attention in lessons. And when you delve deeper, you understand actually there's something much more fundamental beneath the ADHD, which is in fact autism. And there's no surprise. The prevalence of ADHD in children who are autistic is much greater than in the general population. That they do go hand in hand.
So, sorry, on that point then, because I can see me and Taj are like, oh, okay. So how do you differentiate? Because obviously there's a massive link there.
And do we need to differentiate? Is there different ways 100%. Of treating it? Yeah.
100%. So the way I explain this, again, that's another thing. I have a tendency to use analogies, and it sometimes works, sometimes it maybe doesn't. But the way I think about autism and ADHD, I try and explain this to the layperson, is imagine you're seeing two red objects from a distance. From a distance, you see two red objects. They're both red, they're both round, and they both look the same. And it's only when you go up close and you interact with those two red objects, you may realize one's a red ball and one's a red onion. They're totally different, but from a distance they look the same. And that's the best way I could possibly try and explain what autism and ADHD looks like from a distance to the untrained eye, without interacting with that child and spending time with that child to understand what's the more appropriate diagnosis, what's the more fundamental diagnosis. Because equally, nonetheless, they can also have both. Like I've just said, there's a high prevalence of ADHD within the autistic population. So it is very important to differentiate the two, because ADHD is it's almost too vague and too simple. And again, this is where ADHD rates, they have gone through the roof in the number of people that are being diagnosed with ADHD. And my often thoughts on this is, you could have someone who's low in mood and they can't concentrate. They're struggling to pay attention. They lack the motivation to once they've started an activity, to complete the activity. That person has the potential to be diagnosed as ADHD.
Just so that I've understood it, so it sounds like ADHD, you've said, is a very broad term, in which case it's a bit of an umbrella term, because someone said ADHD, but if you go investigate further, it could be autism.
Yeah.
Is there any other conditions that it could possibly be?
100%. Yeah, 100%. So also, to point out, autism and ADHD are equally mutually exclusive, just to kind of make that point clear. And again, not to get messy here, but let's imagine now we were having this conversation in 2012. So every mental health diagnosis is made according to a manual. Think of it as a cookbook. You have a cookbook and it'll say, for brownies, these are the ingredients you need. If you're going to make a Victoria sponge, these are the ingredients you need. That's what DSM manual effectively is. It lists, for ADHD, these are the diagnoses you need. For autism, these are the symptoms you need.
Yeah.
And if we were in 2012, in 2013, that manual got updated to the 50th edition. prior to that, we were on the 4th edition, and on the 4th edition, it said if somebody presents with autism, you can't actually give them an ADHD diagnosis because the autism encapsulates the ADHD.
Okay.
Whereas now, with the 5th manual, they separated it out.
Do you know
So,
what?
yeah,
Do you know what's crazy, Gurmat?
yeah.
And I love your passion
Yeah.
for this. I can see it as, and you know,
Yeah,
listeners
yeah,
can't
yeah.
see it because this is obviously going to go out in audio, but I can see the passion that you've got. But the fact
Oh,
that
yeah,
it's so
yeah.
complex, and me and Taj are
Messy.
like,
Yeah.
oh my God, I can't even imagine being a parent where you're like, does my child have, whether it's ADHD or autism? Because it's such a massive
It's
field.
such a minefield. Yeah. So just to try, I'm going to try and answer your question. So yeah, imagine somebody has now been, and this is why what I say, and I can't stress this enough. If you suspect your child has ADHD, the best way to approach ADHD is by ruling things out. Can I rule out low mood? Can I rule out anxiety? Can I rule out autism? Can I rule out OCD? That's the best way to approach ADHD. Rule things out
that's
and
helpful.
then land on ADHD.
That's helpful.
Do you see what I
Yeah,
mean?
that's helpful.
Whereas if and the other thing I say to parents and other professionals is that, and this is the problem with other private practices. I'm here speaking in the capacity as a private practitioner working in autism and ADHD, is that we see this day in, day out. There's a massive backlog within the NHS to get an assessment, 2 years, 5 years, depending on different areas. So parents will seek a private assessment. And for me, I find it absolutely kind of crazy. You'll go to a private practice and say, I think my child has ADHD. You've straight away biased that individual.
Mm.
That individual will now put on a lens of ADHD, and all that they will see is now ADHD. They're not going to do a full holistic neurodevelopmental assessment to say, actually, I'm not going to assess your child for ADHD. I'm just going to get to understand your child first and foremost, and then consider what's the most appropriate diagnosis.
But for
Do you see what I mean?
for a parent, it's really difficult because if you were to phone the GP and say, they always want a reason now why you're phoning. So if you were to phone them, you're going to say,
yeah.
I think my child's autistic, and they'll just they'll just work with that. So how do if you're going to make that initial phone call, what would you say to the GP to say, right, my child needs to be assessed? Because they're probably going to want to know, the receptionist, they need to know the reason why you're phoning.
Yes. So when it comes to things like autism and ADHD, first of all, it's really important the school are involved. So think about it. I have children. I'm sure you have children. After yourselves as parent, who knows your child best? Not the GP.
The schools, yeah.
It's the teachers. Yeah. It's the schools. So you have to involve the schools. They know our children second best to ourselves as parents, and they see a lot of the communication styles, the interaction styles, how they're managing the demands of school life. Are they able to stay on task, pay attention, hyperactivity, etc.? So you want to work closely with schools, and what I would say to any parent is, don't draw a line in the sand to say, I think my child is ADHD or I think my child is autism. It's too complicated a subject. Even professionals get it wrong. You know, given a 2-hour consultation with a parent, it can take sometimes months before you can be absolutely sure. So what I would say to any parent, if you do go to your GP first, liaise closely with schools, collect the evidence together, present evidence, don't present diagnoses. Don't say, I think my child has autism, can you make a referral? No, say, look, by speaking with the school teachers, I've come to understand my child is struggling to pay attention. They're struggling to make friends. They don't seem to be able to keep their friends. Whatever those difficulties may be, they're always running around and they're likely to get knocked over because they're not paying attention, crossing the road.
But can we trust the schools to do that? Because teachers have 30 or even more children in the class.
Of course.
And
of course.
If you feel as a parent, the gut feeling, I usually go on my gut feeling, there's something quite not right. You go to the teacher and the teacher's like, no, everything's fine.
And I've heard that.
You're right.
Do you know what? I've heard that a few times.
And I'm like, okay, you said, no, that's fine.
I agree.
Yeah. I would still go and follow that up.
Yeah. You know what? And there's a part of, you're 100% right. Totally right. And I see this even within the service I work in. And I don't want to, go beyond that. There is almost a kind of a problem within the system, you could say, that. So, for example, where I work, and I may wish to refer someone for an autism assessment, and what the autism pathway will say, we need evidence from the school, and I can go to the school and say, Tell me how the child's doing. They're like, oh yeah, it's all fine, no problems. And then the autism pathway may turn around and say, well, sorry, Gurmat, we need evidence from not just parents, because any parent could say, yes, my child is struggling. We need what's called collateral. It's called collateral. But thinking about autism now, this is where it gets, it's almost kind of like a paradox, or however you want to describe it. There's a feature of autism which is known as camouflaging, masking. Children will mask, particularly girls tend to be very good at masking. So what that basically means is the child will go to school and they'll copy those social behaviors. So for example, the girl will start to learn and realize, well, when I see the other girls play, they'll feign an interest, and this is how they act, and this is how they play, and this is what they do, and I need to do that. Whereas for you and I, it's subconscious. We have
Then would that be classed as autism and ADHD because you are picking up
yes.
on social cues? In which case, that
Yeah,
takes out
that's
that
a great
triad.
question. Yeah, that's a very good question. So the key difference is this, and I'm going to try and kind of organize my thoughts here. So back to the point, girls camouflage, they mask, and they are very good at masking. But for you and I, for example, let's imagine we were at a party, and at a party we have to behave in a very different way to how we would behave at a funeral. And how do we know how to kind of behave in that social capacity? We see what's happening around us. Whereas if you went to an Irish funeral, I suppose you have to act very differently to how you would behave in a Punjabi funeral, or in any other culture. It's very context dependent. I can't stress that enough. And we would pick that up very easily. We wouldn't have to actively study what the other person is doing. We would be very quickly pick up on the context and go with the flow, like it is going to a party, going to the library, going to the
Read the room, as
supermarket.
they say.
We would read the room, and it's very subconscious. Whereas for an autistic person, so there's a term called cognitive load. Cognitive load basically means the energy um, the, the energy it takes for the brain to do a particular task. So, for instance, if you were to give me a maths paper and say, right, government, here's a maths paper, and at the end of the hour we're gonna score you, that's going to take a certain amount of kind of brain power. And after that task, if you were to give me another maths paper, I'm probably not going to do as well as I did on the first one because my cognitive load has been exhausted. So think about it. Imagine you've had a busy day at work and you've come home and you're trying to kind of eat healthy, but there's a Snickers bar right in front of you. You're going to be like, sod this, I'm just going to eat this. Whereas on another day, if you haven't had a bad day at work and you've actually, really enjoying things, you're more likely to resist that temptation. So the point is willpower, the ability to resist temptation, um, isn't finite. It takes a certain amount of brain power to resist temptations, to use willpower. Back to this kind of camouflaging. For you and I, we wouldn't need to use brain power to do that. It would be very easy for us to just go with the flow. Whereas for a child who's autistic, that requires a huge amount of brain power. That's a certain amount of cognitive loading. In other analogies, they use what's called spoon theory. That you'll need this many spoons to do this task. You need this many spoons to
So
do
they're
this task. And
processing
you
in
may
a
have
different way, and because they're using that energy to process, they'll feel more tired. Whereas
yes.
someone that
And
hasn't
when you
got,
come home,
yeah,
so what the parent sees is that child comes home, it's an explosion. It's like a bottle of pop. So hence why parents always see maybe things that the school will never see. And this is my issue with how some of these pathways work, that no, we must see evidence from school, but sometimes school may not see that finite, that really nuanced differences in the interaction styles and the communication styles,
Can I
etc.
add one more thing? Because not only is
Yeah,
the whole diagnosis, even in the professional field, very much a hard thing to understand.
yeah,
Teachers, like you've said, may not see it because of the camouflaging and XYZ.
yeah.
Let's bring in another factor with the fact that we are a podcast that is aimed at the South Asian community. Now, the South Asian community, with it being a lot of a taboo, in fact, to
Yeah,
say
yeah,
actually my child or sibling or whoever it is may have autism or ADHD.
yeah, yeah,
If we're in denial, and unfortunately we are in this day and age still in denial that our children
yeah,
might have autism or ADHD, how do we go forward with that? And I do want to explore that a bit more, but where
yeah,
are we?
yeah.
So
No,
it's a
for
mess
sure.
firstly in our own heads. Teachers you
Yes,
can't talk to teachers because they say it's fine. professionals are waiting for the evidence, where does the parent? What do you do? Where do you
Yeah,
go?
yeah, yeah. So also, what I don't want it to sound like is we're bashing teachers with this stick.
No,
Not
it's
at all.
not.
And I
No.
often say, no, I know we're not saying this, but I don't want it to sound like that. And I know we're totally all on the same page that we appreciate everyone is stressed to their eyeballs. Like, look at GPs; they're striking. Teachers are striking. Nurses are striking. It's super crazy out there. So what I always like to, what I like to genuinely believe is everyone does have good intentions. Everyone genuinely has a good intention, and they really want to, care for that child and work for that child. So again, go back to the same point: is work closely with school. School may turn around and say, "Well, actually, mum, we don't see what you're seeing, but you know what? Now that you've told us, we're going to try and keep a closer eye on this." And so yeah, that it's a tricky thing to do maybe, because it's like, for a parent, you still may be lost and think, I have no idea what it is even I'm trying to explain to school, what they should be looking for. But I guess any concerns, still I would stress that work closely with the school, with the Senko, with the teachers, to say, look, I have some concerns, I don't know what they are, try and describe as best you can, and work closely with school so they can pick up on those cues. But yeah, I guess within our community, I believe we're almost a generation behind our white counterparts. If you went back to the 1980s, 70s, autism and ADHD wasn't understood nowhere near as how we understand it today, even within the white community. For ourselves, I think we're a generation behind that within our community.
Yeah. Let's be in the position of, okay, so a parent has come to terms with the fact that the child might have ADHD or autism. Where
Yeah.
okay, the teacher may or may not be. We've gathered some evidence. You've gone to the GP and you've said, look, this is the evidence. What happens next in the whole process?
Right. So it also depends. Area to area, it varies, but I think the general rule is if the child is under 5, they will be referred to the local pediatrician. Um, Whereas if you're over 5 and you've started school, you will be referred to a CAM service. So CAMS is where I work, Children Adolescent Mental Health Service. So ADHD, first of all, if you're thinking about ADHD wouldn't be diagnosed before the age of 5 anyway. You will go to the pediatrician and they will say, look, you have to wait till your child is at least 6, and then the GP or the school can refer you to the local CAM service, and then you can start the assessment process there. Only reason is you can't actually treat ADHD in a child under 6. I wouldn't even want to treat in a 6-year-old. You'd probably want to just kind of see how they tend to develop. And I guess we haven't talked about this in much context, or in much detail, sorry, is ADHD also is a necessary lifelong condition. ADHD can very easily, well, I shouldn't say very easily, but you can grow out of.
Oh, I didn't
The
realise
reason
that.
behind that is, yes, the reason behind that is, so ADHD impacts the same part of a brain called the prefrontal cortex, right above our eyes here. Or let's call it the rational thinking brain, or the logical brain. And that helps us make those difficult decisions. For instance, am I going to eat this bar of chocolate or am I not? Because I'm watching my waistline. Am I going to pay attention in this English lesson, or am I going to think about the film I'm going to go watch later on tonight? Or am I going to, drive 80 miles an hour down the 60 mile an hour road, or shall I stick to the speed limit? That's the part of our brain that helps us kind of think about what we're going to do, think through our actions. We call that executive functioning, also kind of planning ahead, prioritizing, organizing thoughts and organizing concepts, etc. And that part of our brain hasn't fully matured until we're at least into our mid-20s. So as that child grows and grows, that part of the brain is getting stronger and stronger, the prefrontal cortex. So their executive functioning is getting better and better. So
So in
often,
that case, if a child is only really diagnosed because they can go to the CAM service at 6, you're saying that they
yeah,
could potentially grow
potentially
out of it.
outgrow.
But
Yes,
then
yes.
does a child, because I would have thought, and I could be wrong about this, children tend to be more hyperactive and have that sort of those issues before 5. So is there a bit of a hoax
Yes,
from the NHS and the whole medical field of, well, by 6 hopefully they've grown out of it and we don't have to take them on then?
totally.
Okay.
Yes, I mean, think of a 3-year-old. 3-year-olds would all be diagnosed with ADHD if we use that criteria, wouldn't they? So because that part of their brain hasn't, so it's a complicated kind of thing to explain. It's called kind of synaptic pruning. and I'm going to try and describe this as best I can. So synaptic pruning is a process that the brain carries out during the early few years, kind of like maybe 2, 3, 4, 5 years of age. The brain is going through this really complicated process, what's called synaptic pruning. Synaptic pruning is essentially, imagine you have a gardener working a garden, and what the gardener is going to do is trim back what needs trimming back to help that plant or tree grow as well as it can. You have to trim it, you have to prune it, hence the term synaptic pruning. And if that gardener is lazy and it's not pruning the tree very well, that tree's not going to grow well. There's going to be probably lots of weeds coming through. It's not going to grow in certain areas, in other areas, so it's going to grow all over the place. And if that part of the process, so that synaptic pruning is happening during those early few years, and it's only after that process, depending on how efficient that process took place in the first place, are we likely to potentially see ADHD or not? So that's another theory around ADHD, is where they say synaptic pruning wasn't as efficient. That gardener wasn't working so efficiently.
So
Hence why that child goes on to develop ADHD.
So if a child, so the child at 6 has been diagnosed with ADHD.
Yeah.
What happens next?
Yeah.
They get referred to the CAM service. Is that within secondary care then?
Yeah, so that's secondary care. They'll be referred to CAMS, and like I say, wait times are, if you're lucky, it could be 1 year,
Let's
could be less.
let's
or it
pretend
could
that
be up to 5
NHS is
years.
fantastic at the moment and is working properly.
And so,
But is it?
yeah,
But it could be longer than 1 year, couldn't it? Because I've been hearing.
Yeah,
people
totally.
are
It could be
waiting
up to 5 years.
Yeah.
Yeah, that's right. That's right. But yeah, so we'll assess that child, and we'll carry the assessment, hopefully as a gold standard assessment, and then the options are what. So we all follow NICE guidelines. So I'm sure you've heard of NICE guidelines.
Yeah.
So I often say this to parents: it's not me and my thoughts or my opinions to treat you. I'm following what the guidelines say.
Mm-hmm.
And it's important that every clinician is following guidelines, because the essence of the NHS is evidence-based practice. We follow the evidence, not just what I think is best. And what the evidence states is, depending on kind of the severity of the symptoms or the level of functional impairment, like what we talked about earlier, one option would be to think about what can we adapt within that person's environment. So thinking about inattention, a young person struggling to concentrate, rather than saying, yes, we need to go straight down the medication route, it could be that we can adapt certain things within the environment. We could either say, right, you've got a maths test and you're going to struggle to concentrate. Let's just break it down into 15-minute chunks. You do a first few questions, have a break. Do another.
So making it very practical of trying to help that child sort of focus a bit more.
So what I say, manipulate the environment. So it could be that you're sat next to a window and you can see all the cars driving past.
Well, move them away from the window, for example.
Yeah,
okay.
It's too much of a temptation not to look out the window, So yeah, you got to think I've kind of realised.
So at what point would medical professionals say, okay, we've tried the practical move the child away from the window, X, Y, Z. What point would they add medication in that case, and what would the medication do?
So, yeah, medication will be, I guess, the next step after you've tried to adapt, the environment however you can to best suit the child. And often, what I say is, every person has a role in that kind of professional clinical relationship. Me as a clinician has a role. The parent has a role. The teacher has a role, and we all have to make sure we're honouring our roles. So when it comes to those environmental modifications, I could send a generic list of recommendations, move that child away from the window, seat him next to another student that's more studious, whatever. That may work, that may not work. So what I often say to parents, look, you know your child best. The teacher knows the child best within that academic placement. So think about individual interventions rather than me giving you a generic list of recommendations. So that's another great piece of advice, or important piece of advice I'd like to give to parents. Think about bespoke environmental modifications depending on what the difficulties are. Thereafter, yes, it would be medication. So medications for ADHD are known as, so there's two families. So every medication belongs to a family. So for example, we all have surnames, so we belong to that particular family. Medications are working exactly the same way. They belong to families. So for ADHD, we've got two families to choose from. One is known as stimulants, and the other one is known as non-stimulants. And again, what the guidelines suggest, stimulants are proven to be slightly more effective than the non-stimulants. So often we would start with a stimulant, try that for a period of about 6 weeks. If that hasn't worked, we could try a different stimulant. And if that hasn't worked, then we would go
stimulants
to the
as in it's I would have thought if a child had ADHD and they were hyperactive, because that's on the triad. Why would you want to?
Stimulants, the last thing.
Yeah. Why would you do stimulants in that case?
Why are we throwing stimulants at them?
I'm like, go the other way. You need to go the other way.
No, again, this is a very, very great question, and it's slightly tricky to explain why they're called stimulants. But in one respect, they're also called stimulants because they stimulate the cardiovascular system.
Okay.
So they, again, it's like going back to like biology, GCSE or A level. So within the human body, we've got two kind of main systems that control all.
I remember this. Don't worry.
Yes. The parasympathetic system and the sympathetic system. That's here. So the sympathetic system is the stimulating system. It gears us up for kind of fight or flight. And it's the parasympathetic system that's the rest and digest. It slows everything down, helps us rest, helps us digest. So what the stimulants do, they stimulate the sympathetic system. So I think that's one of the reasons it's also known as stimulants as well. But the way it helps manage the symptoms of ADHD, essentially what stimulants are doing are providing your brain with a dopamine fix.
Yeah.
And dopamine is a very interesting neurochemical. That's kind of, our body provides us with dopamine whenever we desire something, we want something, and it motivates us to kind of to chase that particular reward.
Right.
And we can set ourselves goals. So, for example, my goal could be that I want to lose, I don't know, a kilogram of weight. So I'm going to set myself that goal, and I'm going to have a dopamine reward to help me keep working towards that goal. So, for instance, I'm going to go to the gym, I'm going to run on the treadmill, and I'm going to feel rewarded for that. I'm working towards a particular goal. If I wasn't being rewarded for that, I'm going to give up. I'm not going to chase that particular goal. And you could say, in some respects, that's what's happening in ADHD. The goal for children is, right, you need to pass this particular test, or you need to pass your GCSEs, and then after that you're going to do your A levels. And we set ourselves goals that, one day I want to be an engineer. So that's what dopamine is doing. It's helping us to kind of meet our goals and to keep ourselves motivated towards that particular goal. And if that's not happening, we're likely to lack that goal-directed behavior, it's known as. We fall off task.
So with ADHD, so again, we've gone to the GP because everything's worked out. You've come around to it. Teacher's happy. You've gone to the GP. They've then referred you to the CAM system. You've changed. I know I'm summarising this actually because I've had to.
Yeah.
They've changed the environment. That hasn't worked. So you've tried medication. With the fact that with ADHD, you said that you could potentially grow out of it. I'm assuming medication, you'd be experimenting for X amount of years to maybe reduce it or wean them off it. Then in 100%. That case, is that correct?
That's right. So I often explain this to parents: is that think about ADHD medication, particularly the stimulants. My analogy again is you think of it as paracetamol.
Yeah.
For example, if you had a headache, you would take a paracetamol, and the paracetamol works for about 4 hours, and after that, you would think, oh, my headache's gone, I don't need it anymore. Or you may think, actually, I've still got a headache, I need to take another one.
That's really
helpful. And you wouldn't take it every day.
See,
and you wouldn't take it every day.
But this is really helpful because I think if you're a parent and you're like, oh, my child has ADHD, the fear is, oh my God, this is a lifelong thing where it could continue. But I just want to move on to the autism side of it now, because I'm assuming there's a different pathway for that.
Yes, yeah. So autism, again, and I'm glad, I guess, we're talking about this briefly. So it's almost like slight changing in the way you would describe and the wording. So with autism and the Autistic Society have really kind of spoken heavily about this and given their voice, is that they like to be referred as autistic rather than saying you have autism. It's not something that you have. For example, I don't have the Punjabi culture. I am a Punjabi. It's something that you are rather than something that you have.
Got you.
So that's the key distinction there. Whereas with ADHD or depression or cholesterol, you can say, yes, I have high cholesterol. I have low mood, or I have ADHD.
So the language is really important for someone.
The language is very important, totally. Whereas autism, it's not something that you have, it's something that you are.
Okay.
And
that's slightly, sorry, just to so with ADHD, then you'd say I have ADHD, whereas with the autistic, and this is where the big sort of difference is I am autistic.
It's almost like this is my personality, this is me.
Okay.
It's your way of life. For example,
Yeah.
we would say you wouldn't introduce yourself, or we wouldn't say I have Punjabi. You would say I am a
Got
Punjabi.
you.
Yeah,
Do you see
got
what I
you.
mean? Just
Yeah.
for the purpose of kind of this context.
Yeah.
So that's for me. First of all, it's important to kind of make that
That's
clear.
really
It's not
helpful.
something that you have. Yes, it's something that it's someone who you are.
Yeah.
You are an autistic. It's the essence of who that person is. It's the way they perceive the world around them, and it's not something that you treat. I wouldn't treat you for being Bal or for being a Punjabi.
Some people
You know?
would,
I
to
was
be
going to
fair.
say,
That's
I
me.
would.
Well, depends where you go. But no, so and the other way I like to describe this is that this is where the environment, again, back to that equation, autism plus the environment equals what the outcome is. So again, back to thinking about it as a way of life, as a culture. For example, imagine you had somebody who came over from Japan, say, and moved into your house, you would need to learn about that particular person's culture to help adapt the environment to make them feel more comfortable. For example, they may have certain kind of
Ways of doing things. Yeah.
ways of doing things. Yeah, for example, the way they eat their food, the way they kind of greet you, the way they drink their tea, for example, whatever it may be, maybe slightly bizarre to someone who doesn't know much about that particular culture. So that's the essence of what autumn is. It's about understanding that particular way of life. It's not something that you need to treat.
Ah, that's
It's not something
interesting.
that
And
we
it's
would throw medicine at. Yeah,
and
yeah,
it's something that we don't need to be afraid of, because I think there are quite a lot
totally.
of negative connotations to quite a lot of these things
Yes,
that we've been talking about. And I think that's what we need to get across, that it's just the way
it's a
that
way of
things are,
life.
yeah,
Yes,
the way of life,
yes,
the way we process things. And it's
yes.
not, oh my God, you've been given this label, it's the end of the world, nothing else can
It's a
happen
death
with your
sentence.
life.
Yeah, totally, totally. Yes, yes. Um,
So I
yeah,
was going to say, where you've said, then you wouldn't treat it because it is a way of life. Then what you're
yes.
saying is we need to adapt. We need to adapt so the person feels more
Yes, yes,
comfortable with.
yes, yeah. And I've made sense of this in my mind, and I had this thought kind of quite recently. Is for me, and children with who are autistic are treated for mental with for various different mental health conditions. Often, anxiety is the most prominent um, feature of autism, and that to me is an alien. Imagine how our parents and grandfathers first felt when they emigrated to England. Totally different culture, totally different way of life. People don't speak your language. People interact in different ways. Imagine how they first felt coming to the UK.
If
Yeah,
it's
yeah,
the way of life for someone that is autistic, now I'm
yeah,
careful in my language. Actually, that's so helpful to
yeah,
know
yeah,
that.
yeah, 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 yeah.
Can you, with like ADHD, I guess, where you adapt the environment to help them sort
Yes,
of, you know, adapt, I guess,
yes, yes,
within someone that is autistic, do you then adapt the environment to make them feel comfortable, or do they then also go through this thing that you said, camouflaging, for example? Like, or
yeah.
can they not? Can someone with that is autistic not then camouflage because that is the way they are? They are processing it in this way.
Yeah, so like I said, girls tend to be the ones who are more likely to camouflage.
Even
Again,
with
generalizing. So girls,
even with
yes, who
autistic. Okay.
the autistic girls, yes, yes, they will try and camouflage. But like I say, that takes brain power,
Yeah.
and there's a consequence to that. The consequence will be inevitable, where either when they come home or they struggle in other aspects of their life. So hence why I say anxiety is a very key feature
Ah.
of autism, because it's unfortunate that yes, the world is not an autism friendly place. Autism is it's a minority population naturally, so the world isn't going to be adapted to the autistic. So essentially, what we're treating in autism, we're not treating that young person's autism. We're almost treating them because the world can't adapt to them. Do you see what I
Mm.
mean? We're almost treating the lack of almost understanding.
Explained it. I mean, for me, I think you've really opened my eyes up to the fact that it's the fact that the world's not ready for them,
Precisely,
not the
yeah,
fact that
yeah, yeah. That's what I mean. It's not that, and I can't stress there's nothing fundamentally wrong with that child. What's fundamentally wrong is that the society around that child doesn't understand and can't adapt themselves to that young person. So
What
we're treating them because society can't adapt to them.
what would you say to people, maybe from the older generation? We can't always say that,
Yeah.
but as saying that we just like to put labels on people. We never had this in our day. You just got on with it.
Yes, yeah,
Is
I
it
guess that's
because
lazy. Yeah.
you're taking it
Yeah,
too
for me,
far?
yeah, no, I think that's lazy thinking. And and something I was studying earlier today, actually, in fact. And it's sometimes tricky to explain. Like, we all have concepts. Concepts help us understand something. So, for example, when a young person sees a dog for the first time, and this is something about how does the brain form memories and how does the brain understand stuff. So the brain is constantly creating new concepts. So we see a dog for the first time, the brain will create a concept, and whenever we see another four-legged animal, the child may see a cat, and we'll say to the child, no, that's not a dog, that's a cat. And as the child sees more dogs, it'll strengthen its concept of what a dog is, and equally it'll strengthen its concept of what a cat is. So no, it is important we give it a name. We need to develop a concept of what autism is. That's how we understand the world around us, by creating concepts. If we didn't create concepts, we wouldn't make sense of the world around us at all. We wouldn't have the concept of what a dog is, of what it means to be happy, of what the concept of a mobile phone is, for instance.
You know what's just stuck in my head, and from what you've said earlier, is the fact that it's a minority community. Now, if we then
Yeah.
apply it to, what our target audience being South Asians, it's the same thing. We're a
Yeah.
minority community
Yes.
who is trying to get equality in XYZ, and it's the same thing.
Yes. Yeah. Yeah. Yeah.
People who are autistic, if they are a minority, they also need that equality. In which
Yes.
case,
Yeah. Yeah.
society
Yeah.
needs to adapt. I think that's
Yeah. Yeah. Yeah.
stuck in my head really nicely to make me understand what the difference, firstly, between ADHD and autism is. But
Yeah.
the fact
Yeah.
that we as a community, a whole society, needs to
Yes.
understand
Yes.
that there isn't
Yeah.
something wrong with this person. If anything, there's something
Totally.
wrong with us because we can't adapt.
Yes, we can't seem to. And for example, like talking about it, and for example, my dad, for instance, autism, they've never heard of autism. There's not even a Punjabi word for autism, and 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 this is the other thing I stress to parents, and I've read this in another book, that if, imagine you've got a child who's autistic, it doesn't mean now all of a sudden you need to become an expert in autism. No, all I would say is pay attention to your child. By paying
And that's
attention,
with any
you will
child, isn't
learn.
it? It's not.
That's exactly, precisely my point. Back to the analogy of, imagine you've got somebody from Japan who's come over. You have to pay attention to that person. How do they behave? How do they interact? How do they live their life? If you didn't pay attention to them, you wouldn't understand that.
It's almost like being a parent. It's almost like, because we're not given manuals. Well, I didn't read any
No,
books into it,
no.
to be honest. I'm not a very good reader
Yeah,
anyway.
yeah,
You
yeah.
just take it as the child comes and you adapt with the journey,
And you
don't
pay
you?
attention. My child's crying. She may be hungry, or I need to change her nappy, or she may be winded, for instance.
But then when it comes to the other side of things, say if you've got a parent that, like, again, I'm probably going to use the child staring out of the window, and you just say, oh, that's just my child, and you don't get it diagnosed. I think there's quite a lot of people that are doing that as well, just saying, this is part of my child. There's nothing,
But I
Yeah,
think,
without
yeah,
saying that there's
yeah.
but I
something
think
like diagnosed. Yeah.
But Taj, I think the thing there is the fact that we're not coming round to it. In which case, you're not, for example, with ADHD, you're not getting the support that is available, or you're not getting, the
Yeah,
support,
yeah,
talking
yeah.
to other people that might have a child who is autistic to say, well, actually, no, this is how we do X, Y, Z. Like, we go to a support group, a mothers group, when we have kids, the same
Yes,
thing. I think that's where
yes.
us as parents are losing out. It's not the fact that they're going to get. It's just the support for us, if nothing else, and the
And it's
child.
almost like, you could say, particularly within our community, it's we don't like to maybe talk about it as openly as, even as I would hope I would like to talk about it openly. Sometimes it is a bit of sometimes a tricky conversation to get into with even family and friends. For example,
And it opens up the conversation. And this is the thing: all of the things that we are trying to raise awareness with on the Changing Suits platform is the fact that, look, if I was to say this, it means that someone else is comfortable to say it, and X, Y, Z,
totally,
and that is
yes,
happening in every
yeah,
single
yeah,
subject a topic that we are
yeah,
talking about.
yeah, yeah.
Gurmat, like I said earlier in the podcast, we are having an event on Saturday, the 20th of May, at Freshbrook Community Centre in Swindon, and this is an opportunity for parents, carers, and someone who is autistic to come and learn what support is available, because that's the important thing. I think regardless of, I think you've put it really nicely in the fact that support is there regardless of whether a child has autism, or see, I've said it wrong there and how I need to change it. No, I'm well aware of that. I need to change my own thought behind that. But it's about the support. The pathways firstly are complex, so let's get our head around the pathways. How should we be approaching teachers? What do we need to come to terms with ourselves culturally as well? So that's something that we're going to be discussing on Saturday, the 20th of May. So anyone that has those thoughts of perhaps I do need that support, I don't know if my child has ADHD or is autistic, is that correct way of saying it? Then come along if you've got those things. And also for teachers or people that are interested in the subject, come along so we can support others that are that need the support as well, and so you can learn those things as well. Just as we come to the end of this podcast, Gurmat, could you give us a bit of information if a parent is having listened to this and thinking actually perhaps my child has ADHD or is autistic, what should they do next?
I guess the first thing is, gather the evidence as well as you can. Don't go in with a diagnosis in mind. And again, I guess I can't stress that enough. Don't make up your mind as to what you think maybe the diagnosis for your child. Don't let anybody else influence you on your thoughts. You know your child better than anybody else. So yeah, think very clearly as to what your concerns are. And as much as we would normally say, and I would always say this, never compare yourself to anybody else. It sucks the joy out of everything. But when it comes to developmental concerns, no, it is important you compare your child to another child, because that's where those differences become more apparent, don't they? And it's by collecting that evidence and presenting that either to the teachers or to the GPs. One would hope they would take appropriate action and refer you appropriately. And also, I guess, like I said earlier, stress that enough. Work closely with schools, and I genuinely believe teachers have best intentions at heart. But of course, naturally, sometimes they may not see what you see. But it's just really bringing it onto their radar to say, look, I have these concerns regarding my child. Again, not thinking about a diagnosis in mind, and we're trying to see if they can add some weight to your concerns and then take that forward together. So yeah, that's my key advice. Think about kind of the features rather than a diagnosis. Yeah.
Perfect.
Yeah.
Thank you so much for all of the information. And like I said, I love the passion that you talk about
Oh, no problem.
it
Thank
as
you.
well. And it is, and I've learned so much. I always do. I mean, to be fair, I've said this before. I think we get the guest to come on just so that we learn about the topic
Oh,
as
bless.
well.
Yeah,
And I
yeah.
genuinely have.
That's your CPD done.
There we are. That is. So
Yeah,
thank you
yeah.
so much, Gurmat, for your time
No
today.
problem. No, thank you both as well. Thank you both, Bal and Taj. Lovely to meet you today.
That's goodbye from me.
And that's goodbye from me.
Follow us on Instagram and Facebook, changing_suits, and subscribe so you never miss an episode.